Hello, and thank you for joining us for another edition of Matters of the Heart. This is a show brought to you by Pentucket Medical Cardiology and Haverhill Community TV. My name is Dr. Sunny Srivastava, and I'm here today with one of my associates, Dr. Seth Bilazarian. And today we're going to talk about something a little different than usual. We, in the past, have focused in on a lot of very specific cardiology topics, but today I think we're going to focus in on some current events, if you will, and one thing we're going to focus in on is a new health initiative that's been brought to you, or brought to us, I should say, by the Department of Health and Human Services, and that's a campaign to talk about, I think I would call it patient empowerment, and 10 questions you should ask your doctor is what it's entitled. So with that in mind, I'll hand it over to Dr. Bilazarian to lead with some introductory remarks.
Sure, that'd be great. So thank you, Sonny, for that introduction. What we wanted to talk about today is something that something called the Agency for Healthcare Research and Quality. It's available on the web, and we have a slide of just what that web slide looks like, so we can show that. But basically, this ahrq.gov is got a wealth of information. So basically, I'll just tell you that on one of the sidebars, if we go to the next slide, there's some general information that we can highlight that patients may be interested in, people in the audience, if we go to that next slide. And you'll see that there are several things, some of the things that we've talked about. In a prior episode of Matters of the Heart, we talked about the hospital comparison data that you could get by comparing local hospitals. And during that show, we compared the community hospitals in our area and showed that they did quite favorably in some key cardiac indicators like congestive heart failure and some other indicators. And that is available for people in the audience to review, to get information about other aspects of their care. There's surgery data and other kinds of things. There's information. There's a public awareness campaign that some people may have seen on television entitled Real Men Wear Gowns, talking about how men should do a better job in getting screening for cancer or other kinds of things. That's available on that. There's information for Spanish speakers with regard to health issues. There's information on the flu. There's a very good part of this website that gives information about how to compare a common cold from seasonal flu or influenza compared to H1N1 or swine flu. So some basic information available for people if they're interested. But I'm focusing on that circled red area, asking 10 questions you should ask your doctor. So that's really what I want to focus with you today about, to just talk about some basic information about what ways that patients can ask reasoned questions for their doctor to get more understanding about things. I think we all know, it's published in the literature, but I think we all know that if someone understands a situation, understands why they're doing something, they're more likely to participate and cooperate. So in the old days, before my time, doctors used to just give a pill to a patient and a patient would just take it, maybe not always knowing what the issues were. And I think that we know that there are certain advantages to that, especially from a doctor's standpoint, that it takes less time. But we know there's certain disadvantages because patients are more likely to, not follow through or do other kinds of things that are helpful to their care. So the 10 question initiatives has come up as something that's being advertised on TV by the Health and Human Services. The next slide I'll just show you is a cute part of the TV ad. The TV ad says that when you go out for dinner, you'll ask him about the side dish. And when you watch this TV ad, you can watch it on the website. It's a woman who's out for having lunch, and she asks the waiter, is it fried? Does it have cheese with it? Is it spicy? She asks many, many questions about her side dish of broccoli. But then the next slide, she goes to the doctor, and the doctor says, are there any questions? And she says, nope, there are no questions. So it says, won't ask him about any kind of side effects. And then the next slide is what encouraging our patients to say, questions are the answer being, how we can do a better job taking care of patients and how patients can do a better job for themselves in participating in the care. So the next slide is really the 10 questions that have been highlighted as the 10 questions that this agency has recommended. And I'll just quickly run through them, and we're only going to handle the bottom 3 that I've put check marks next to. But the top ones are, what is this test for? So when you are you being recommended for a particular kind of test? Ask the doctor, what is it for? How many times have you done the test? Asking the doctor. What will I get? When will I get the results? Next one is why do I need this surgery if you're being recommended for surgery? Are there any alternatives to surgery? What are the possible complications? And which hospital is best for my needs? And we talked a little bit about that again in our hospital comparison section, but there are other information that you can find out going to the hospital comparison website if you're looking for information about general surgery or other kinds of issues. The bottom three questions are the real questions that we're going to be focusing on today, which really circulate around issues about a medicine prescription that a doctor might give. And those are, how do you spell the name of that drug? So when a doctor says, I'm giving you a prescription, how do you spell it? And then number 9 is, are there any side effects? And number 10, will this medicine interact with medicines that I'm already taking? So those are the three basic, 3 of the 10 that I want to cover today as the 10 questions you should ask your doctor. The website actually has separate categories of questions for if you're having a surgery, what 10 questions you could ask. If you're having a test, what 10 questions you can ask. A variety of different sections, but there are 10 questions or more. There are actually 15 that they have for drugs. But we're going to go through that a little bit. Any thoughts initially about your thoughts about drugs and drug prescribing?
I mean, I guess I would just add anecdotally that every day in my practice, and I'm sure in yours too, I have people, their scenario just happens just like what you depicted with those TV ads, that we'll talk and talk and talk, and at the end say, do you have any questions? Or what else can I do for you today? And nope, nothing. And then people go home and they often think of questions, but then they don't call back or what have you. And I will agree that many people are not empowered at the doctor's office to ask questions.
Okay.
So I think it's a neat or interesting initiative, certainly.
Okay.
So what the next thing I guess we would talk about here is the medications, and when patients are given prescriptions, how they should handle that. Is that a
right? I think that's something, and obviously it's you have as much experience in this regard as I do, so let's just generally talk about that. So we write a prescription for something, either cholesterol or blood pressure. We have a computer now, but it's equivalent to handwriting a prescription. But we write the prescription, we print it on the computer, we sign it, hand it to the patient. Is that the end of the interaction? What else should be happening?
Right, so ideally, no. I would
Okay.
say. I mean, I think we all like to think we do this, and maybe sometimes we don't. I don't know, but number one, explain why you're giving the medication. Certainly. Number two, explain the likely side effects, and then even the more rare side effects. And I think even prior to that, you could, if it's reasonable, discuss alternatives to the medication as well. That comes up often.
Okay.
Sometimes there might not be an alternative, just given the clinical scenario.
Okay.
And really, I've definitely come to learn really clear instructions about how to take it, especially when you're adding it to other ones that are already being given. I've seen a lot of times where the others get stopped, and that this is thought to be the new one, and the only one, and that really messes things up quite a bit.
Okay.
There's a few things I think of off the top of my head.
Sure. So I think that I guess to emphasize what you just said, I would say that we want to have the patient understand, even the most basic way, that this is a medicine for blood pressure. Right. Your blood pressure was high. Having a high blood pressure is dangerous. This medicine is designed to lower it, and that's really what the goal of this treatment is. So some patients will say, a variety of things, understanding not only why we're using it, but there are other misconceptions. I'm sure patients have said that to you. They'll say, my blood pressure at follow-up is now good. Can I stop the medicine? Right. And of course, that, from our standpoint, is no. The reason why your blood pressure is now good is because of the medicine, so you can't stop it. But the other point I think is a good one, that some people think that they can stop other medicines, or that they take it for the month and then they can stop it. That
they run out with a prescription, and instead of calling for a refill, or they just assume it's done and the treatment course is done, like you would be with an antibiotic, for example.
Okay.
So that's, I think, is an issue, and I think you'll probably get to these things, but certainly giving somebody written out instructions or a medication list, I think is probably...
We're definitely going to cover that, and that's definitely another recommendation by the National Institutes of Health that, I think that, I don't know why, but when I started practice 17 years ago, that seemed like it wasn't really being done very much in our community, and I designed a medicine card and some other strategies that I think patients have really taken to as a strategy to keep track of what's going on. I mean, I would have trouble keeping track of these medicines, and I'm an expert in them. Right. So somebody who's less expert, keep track of 8 or 10 different medicines is very difficult. So I wouldn't expect someone to do it without assistance, some kind of a memory aid or a mental aid. So just to review what you said, I think that we want patients to understand the importance of why they're on the medicine, and we want them to, basically take it correctly. I think you said both of those things very well. I have nothing to add there. That correctly means, once a day, and try to take it at the same time every day, and also, of course, to avoid stopping other medicines if that's not appropriate. And I think that the partnership part of it is really a key thing, because we can write prescriptions all day long for the best medicines in the world, but if the patient doesn't take them, they're really of no value. So then the second thing I guess we would say is tracking the medicines is an important thing, in that we want patients to try to reduce the medical mistakes as much as possible and improve the quality and the safety and the effectiveness of these different treatments. They're not going to work if they don't take them. And one of the things that many patients are doing nowadays, of course, are taking not only medicines that are prescribed by doctors, but a variety of other medicines. Some of them have been shown to actually be negative. One of them that we've talked about on previous matters of the heart is vitamin E, and it has a negative impact on cholesterol medicines. It lessens the good parts of cholesterol medicine. So that's an example of, if you don't tell your doctor you're on these other vitamins, then we can't help give you counsel about it.
Right. And I think I would add to that as well the fact that many patients see many doctors, and so there are lots of chefs, if you will, who are contributing here. So it's always imperative, I think, for people to bring their complete medication list, not just the ones that I've prescribed, for example. Because I think that brings us to the point of talking about interactions as well. People, an important question to ask is about interactions with other medications.
Sure.
And we can look at these things, and certainly our computer systems have, pop-up alerts if two medicines that are prescribed that don't go well together.
Right.
There's a lot of systems built in to protect from that, but things can still happen sometimes.
Right, but of course, as you said, even on a more basic level, we can't have the computer pop up to say these two medicines are dangerous if we don't know the patient's on the other medicine.
Right.
So if a patient comes to see me and from their doctor who's, maybe in another town or somewhere else, has prescribed a new medicine, or another specialist for some other medical problem has prescribed a new medicine and we don't know about it, we can't give advice in that regard. So I agree with that completely. So keeping a list of the medicines constantly active. I mean, I really think every doctor should update medicine lists. We give one at every one of our visits. So if a patient goes to another doctor, they could even write it on our list if they don't have the mechanism to give a new list. So keeping that up. And then if there's any question, I saw a patient today who has a variety of medicines but doesn't know what they're on. They're new to the practice. We had no ability to find it out, so we've asked them to return with the bag of all the medicines. And that's a good strategy if you have a variety of changes or you're new to a practice. Just bring all your medicines in. Errors can happen anywhere in the system. We think that pharmacists are very capable and ethical and very good at their profession, but of course medicine mistakes can even occur at the pharmacy level. Patient can get the wrong medicine, the wrong dose or something. So having multiple checks by even checking the bottles can be very valuable. So I think keeping these things in track in that regard is very helpful. So then moving on, I guess I would say, is then how can we advise patients, we've touched on this a little bit already, is how can we advise patients to take medications safely? And we really want the medications to help the patients. We want them to avoid mixing medications that might be dangerous, but we need to know that. So having patients understand what medicines they're on and why they're on them can be very helpful. And also understanding what side effects are likely and what side effects are unlikely. So I think what happens sometimes is when patients take a new medicine, anything that happens, they say, well, it must be from the medicine. And of course it might be, but it might not be. If someone takes a medicine and then gets the flu, well, it may not be the medicine that caused those symptoms. It could be that they just got the flu, and it may have happened about the time they started the new medicine. But there are some medicines, like there's a commonly used blood pressure medicine called lisinopril, which we're very fond of. We think it's a wonderful drug. It does great things for hearts and kidneys and reduces stroke risk. But in about 5 to 10% of patients, it can cause a cough. That's a side effect. And I have to admit, sometimes I forget to tell patients that, if you get a cough, let me know, because it's an uncommon side effect, and patients may come back and not know to tell me because it's not an expected side effect. So knowing what side effects are common.
Yeah. And I think also informing people ahead of time of the likely side effects, and even perhaps some of the more rare ones, I think helps with adherence to the medication over the long term. I think if people know what to expect, for example, a medication Niaspan, we know that it's a medicine we give to increase the good cholesterol, and it causes flushing. There's nothing bad or dangerous about it. It's a nuisance. But I think if you didn't tell somebody that ahead of time it happened, they might not take it quite so well as if they were expecting it and knew it was coming. So I think it does have an important role in that regard too.
I'd agree with all that. The one thing that I guess I would say is something that I have difficulty with as a physician, and I really would like to have your input on, is when patients go to the pharmacy, they will get a long list of the side effects associated with a drug. And of course, I'm not opposed to patients getting information, but the problem with the list that's given is that it's every possible side effect that might have ever happened.
Right.
So if one person somewhere reported that they, had an ear itch, then it will be listed as a side effect. Whereas I think it would be much more valuable to have a list of side effects that are common, that you might expect, rather than every possible side effect, because it's sometimes hard to interpret. You have a side effect list with 20 things on it. It's hard to interpret.
I think every list includes nausea, for example.
Right.
And it's, So it is. I don't know. I don't have a magic answer of how to deal with that, other than having a frank discussion with people about the probability of this side effect X being due to the drug, or.
Right.
And also, I guess, weighing the importance of what you're trying to treat here too. I have a lot of we both, I'm sure, have a lot of patients who, when we are talking about high cholesterol, and we want to treat their cholesterol, and a lot of people will give a little pushback saying, well, I've heard it can damage my liver. And it can. It's a rare side effect, but not zero. And you talk about the alternative and the risks you're leaving them exposed to. I think most people can balance that that risk.
Right. I guess I would say I agree with that completely. The other one that I think about often is the newer medicine that we use sometimes to help people with quitting smoking, called Chantix. Mm-hmm. People will say, I've heard bad things can happen, but of course the risk of smoking far outweighs the risk of a medicine like that. So I guess that would be another example of the side effect. We should acknowledge that they exist, but that the side effects are outweighed by the potential benefit. Right. And I guess the other thing, I guess your comments made me remember, is that something like blood pressure medicines, of course, can lower blood pressure. That's their goal. But with that lowering of blood pressure, early in that stage of blood pressure lowering, patients can feel a little bit of lightheadedness. And that's something that will go away after a week or so in 90% of patients. Right. So if patients get nervous and stop their blood pressure medicine, they'll never get their blood pressure under better control. Right. This is another example of something that I think is a side effect, but it's sort of expected and often minor and well tolerated. So though I guess those would be the main issues, I would say. But I guess the other resource that I would encourage patients to use as an excellent resource for side effect monitoring and counseling is the pharmacist. And I think that they do a very good job in that regard.
Yep, absolutely. Yeah, I think we've covered a fair amount with regards to the medication issues. I looked at your material before. You had some other slides. Is there anything else you want to cover about medication questions patients should ask their prescriber or physician beforehand?
Yes. Well, we have a couple of things. I would say that the other thing that I just want to make sure we cover is that that patients should be clear about whether they need some kind of a follow-up with a new medicine. So with a new medicine, for instance, the medicine that we commonly use, a medicine to help patients get rid of fluid, either for blood pressure control or for congestive heart failure, is a medicine called Lasix or furosemide. That's a very good medicine, but for instance, it can lower the important electrolyte called potassium. And if potassium is lower, that could actually be dangerous. So patients may need to get that level checked. So I'm not suggesting patients need to remember that, but they should ask, if they have a new medicine, do I need any kind of lab test check a week or so after? Another common medicine that needs very important and regular checks is a medicine called Coumadin or warfarin. That's a blood thinner. Mm-hmm. So these are examples of some medicines that we use commonly, but of course need follow-up. So there are medicines that do need those kinds of regular checks. Of course, other medicines like cholesterol medicines, we of course want to know whether there was a good cholesterol effect. So we would check blood tests for those kinds of things. So what kind of follow-up testing is necessary would be another thing that I would encourage patients to ask about. There is this very long list that we could go to. It's questions to ask before you take your medicine. It's kind of hard to see, but I will just run through it on the screen there. There are 15 questions, if we could put that up again. So I will just go through it for those who want to get up close to the screen, but I'll just run through them. I think we handle most of them. It's important to know the brand and generic name of your medicine. We give this to our patients in our list when we provide medication lists. Can I take a generic version of this medication? The answer to that question is almost always yes. What am I taking this medicine for? We covered that. Is it a blood pressure or cholesterol or some other problem?
Can I interrupt you for
Sure.
a second? What do you say to people when they want, for example, the brand name only versus the generic, or the impression being that the generics are no good?
Okay.
How do you counsel them on that?
Well, my counsel to that is that I don't really think that there's ever a reason not to take generic medication. The FDA has regulates and monitors that these generic medications have equal potency with the branded drugs. So from the best of our ability, from a chemical science standpoint, a pharmaceutical science standpoint, these drugs should be equivalent. I'm not disagreeing that there may be some differences that patients experience. For instance, the filler or the coatings may be different. There's a rare chance that a patient may have an allergy to a filler that's in one and not in the other. So it's possible, but the vast majority of patients, the generic, should be equivalent. There should really be no reason not to take it. What is your sense about that?
The same. I just wanted to make the point for the viewer because I get that question, not a lot, but occasionally.
Right. I find that question has come up less frequently in the last several years as the insurers have really charged people to take the branded drugs. Yeah. So patients will be charged $50 a month for a branded drug copay, but only $10 a month for a generic drug copay. So for that reason, many times patients are willing to at least try the generic because of the significant cost savings.
It's almost a lot of people now are even asking preferably for the generic just for that reason.
Right. So. It's something that I do at every visit almost with my patients. They'll say, where can I save money? Are there any generic options? Right. And we try to keep them abreast of that. We know some medicines are going to be generic, like a commonly used medicine. Plavix will be generic in 2011. We have to wait a little bit longer, but it's coming. There's other medicines, for instance, like the angiotensin receptor blocker called Cozar, which will be generic next year in 2010. So it's coming, but we try to be good about that. So if we can go back to that list again, questions to ask before you take your medicine. I'll continue that list. How do I take the medicine and how often do I take it? If I need to take it 3 times a day, do I take it with meals or every 8 hours? Do I take it? Do I need to take it all, or should I stop it when I feel better? For most cardiology medicines, it would be always. How long will I be taking it? Can I get a refill? How often can I get a refill? Are there any tests I need to take while I'm on the medicine? When should I expect the medicine to start working? How can I tell if it's working? When should I tell the doctor about a problem or side effect? Are there food or alcoholic beverages or other medicines that I need to avoid? What are the side effects that can happen with this medicine? What should I do if I have a side effect? What happens if I miss a dose? And what printed information can you give me about the medicine? And so I guess the one question that I think we didn't handle as I went through that and I recall is that what happens if I miss a dose? Right. In general, our counsel for most drugs is if you miss a dose and it's before the next dose is due, it's appropriate to just take it. So if you take a medicine at night and you forget and it's available in the morning, just take it. It's generally not a problem. For most medicines, if you are, miss one day, once a month, it's generally not a problem, we think, at that level. But if you're missing it more frequently, it can be a problem. There are some medicines that we've talked about on this program. For instance, Plavix. If you have a stent in your heart artery and you miss Plavix for 3 days in a row, you're at very high risk for having a heart attack or death. So there are some medicines that are critical. I would say warfarin is similar to that about missing it. So taking it as soon after as possible, that would be very important.
So I think we've talked pretty extensively about medications and empowering patients to be better prepared to take their medications. And I know the website, that AHRQ website, talked about other procedures and questions patients should ask. Before I move on to that, is there anything else you want to say about medications? Or?
No, the only thing I was just going to show is an example of a patient's drug list from our practice, because our practice is the last slide we can show. Our practice has an electronic medical record, and this is an example of a patient I saw in the last week with a list of medications. And my approach has been to try to group medicine. So the first is cholesterol medicine, the next is blood pressure medicine, the next is non-heart related medicine, and then commonly used other medicines like vitamins at the bottom. So I've tried to sort of group them together, and then for the patients, it's very easy for me to say, number 1 is for cholesterol, 2 and 3 are for blood pressure, and et cetera. So it's an example of a strategy that's available, and other practices do similar things, I know, either with medicine cards or other strategies, but I think this is very valuable for patients to get almost at every visit. Yep.
Okay, so on that note, I guess I'd move on to some of the other things that they talked about on that website. I know we don't have any visuals or graphics for this, but something I think we can talk about pretty easily. A patient is getting you ready to go for a procedure, one that you do commonly, a cardiac catheterization. You've explained the procedure, and I suspect that often patients say, okay, yep, and that's it. And what should they be doing? What else should they be asking you or talking to you about?
Well, I think that you've made the point, a very good point, that in this whole interaction, as much as we want patients to feel comfortable, we try to set up a situation where they're sitting in a comfortable chair and we're sitting in a comfortable chair and it seems like a relaxed environment. Of course, patients are intimidated, and hearing the news that they might have a heart artery blockage may be so overwhelming that they can't even think at that point. So we have an expectation that questions may develop. In the example of the test that you described, there's a very lengthy process where they first meet with one of their cardiologists, for instance, you or me, have an explanation and have a review of the risks and benefits and why this is a recommended strategy. But then they also meet with one of our nurses to review again all of the mundane but important things about whether they have to stop eating the night before, what time they need to arrive, what kind of preparation they need to make, what medicines they need to use, what kind of testing needs to be done before. So it's a lengthy process in which usually during this process more of the questions that they have are answered either without them asking, but then at the end of the process we have patients that call back and say, I do have an additional question, and we're of course happy to answer that. So we want their questions to be answered. It's of course very valuable, in my experience, for patients to come in with other family members. I find that to be much more helpful than trying to answer these questions, because invariably what happens is they go home and they talk to their spouse, and the spouse will say, well, did you ask this? Did you ask that? And then it becomes very difficult to sort of answer exactly what there is. And of course, from our standpoint, then we're answering the questions multiple times. So if it is anticipated that someone's going to have important news like testing results or more testing recommended or surgery recommended, I really do recommend that someone go with a family member, either a spouse or a child, to be able to have these questions answered and have another set of ears in the exam room to hear what's going on and to be able to answer questions. I think so that would be a very practical recommendation that I would have.
Yeah, and I think also prior to the actual consenting to the procedure, much along the line of what they're talking about with these medication questions, I think it's reasonable for patients to ask about alternatives to treatment, obviously the benefits and risks, which is what we review anyways. And do you find a lot of people asking you about your experience with the procedure or no?
Patients sometimes ask, and of course we share that freely with them, how many procedures that we've done and what the institution, some people ask, which institution should we go to, because we go to many different institutions. So we're happy to share those things and try to be honest. Patients will often ask, if I was your mother, or if this was your mother or sister, what would you have done? And I'm happy to answer those questions. I try to answer those questions that way, even without that prompting. But those questions are welcomed.
Okay. Well, I think we're starting to run out of time here, but I think this was a very nice review, or introduction, I should say, to I guess what I would call it is some patient empowerment to with regards to the healthcare. And I think actually maybe you could repeat for us the website, what it's called that people can go to.
It's called ahrq.gov.
Okay.
The Agency for Health Research and Quality, and it's part of the National Institutes of Health. And if someone just Googles 10 questions to ask your doctor, we'll take you there as well.
Okay, great. Okay, well, with that, I think we'll wrap things up. I want to thank you for joining us for another program of Matters of the Heart. It was brought to you by Pentucket Medical Cardiology. My name is Sunny Srivastava, and I'm here with Seth Bilazarian. It was also brought to you by Haverhill Community Television. Thank you.
Great.